were, severe bloating, constipation, digestive dysfunction, and I had severe gas. It was really bad for like 1 year. I couldn't go beyond the people. So sometimes I had to just, cancel meeting people. And whenever I felt better, I would try to go out because you get depression with all of this stuff. So you have to make sure you keep your spirits up because I did spend a lot of time alone at home. Yeah. What else? A few tests that were done, maybe that might help some of you, is I did different analysis of my gut. So my gastroenterologist, he wanted a GI map test done. And yes, there is gut dysbiosis happening. I also did an AI, artificial intelligence microbiome analysis with NBiosis. I don't know what to think about it. Also, some of my experiences were that there's so many opinions out there, even amongst doctors, and with the different tests. Some people, I would talk to some people, they're like, yes, you have a gluten intolerance. Other people say, no, you don't. And then I had tests, don't eat dairy. You have casein intolerance. Don't eat beans, don't eat that. And it was so contradictory amongst all the different doctors, like, I don't know what to believe. In the end, I just do what I think is best for myself based on my own experiments. And I can tell you that staying away completely from grains, all gluten, all dairy, I do much better. And the reason why I stay away from grains as well is just because of all the pesticides and herbicides and all that shit that's in there. I mean, it's in everywhere. You can't eat anything anymore, but at this point, I literally only eat meat, which I would prefer not to for moral reasons, but I have to because I just lost too much weight and I'm losing too much muscle mass. So I'm eating meat, vegetables, and salads. That's it. All right, we talked about NBiosis. Right, the other thing I got diagnosed with, which really, really sucked, I mean, it was just so crazy, is interstitial cystitis. And what that is, it's a chronic bladder pain in your bladder, in the wall of your bladder. It's a chronic inflammation. And that did also start during the pandemic. At the beginning, the way the symptoms showed up is similar to UTIs, urinary tract infections. And initially they were positive, but then I would get these symptoms all the time, yet the test came back negative. So it was super frustrating because, again, I'm telling you, the doctors, they just do their tests and like, no, it's nothing, you don't have anything, you're good. Or just prescribe you with antibiotics. So I'm the kind of person, I don't give up. I'm really my own advocate and I do my own research. So I ended up watching a bunch of these YouTube videos, came across a nurse who had suffered from interstitial cystitis since she was 20. She's in her 60s now. And she made it her life mission to help women who suffer from this. So I came across this company, and it's all, again, out of pocket, that does DNA urine sequencing, and it tests, I can't remember how many bacteria. It also provides you with the kind of antibiotics that are resistant and which ones you can actually take. So if you suffer from something like that, it's not just urinary tract infections, all kinds of stuff. It's actually really great. Check it out. It's called MicroGen-Dx. MicroGen, GEN-DX, D as a dog, X. Google it. It'll pop up. So I highly recommend that for any sort of health issues that you have. Look into it. I already mentioned that for those of you who've just been gradually getting sicker and sicker, and you go to the doctors and everybody's saying, no, you're fine, we can't find anything, I highly recommend you get the test done for the protein spike. and it's the SARS-CoV-2 spike protein IgG. Okay, get that done, because that's how I found out that I have long COVID. You know, I've done so many tests for so long. If I would have known that from the beginning, that would have helped a lot. Ironically, what's happening is, for some strange reason, with COVID, whether it was the vaccination or the virus, a lot of people are getting diagnosed with viruses from the herpes family, and it really sucks. So in my case too, I was diagnosed with Epstein-Barr virus. It said a past infection, and so those when I did the research on the symptoms, they just seemed very, very similar with also the symptoms that you find for long COVID. And so then the question is, well, what do I have to get treated for? Do I have to get treated for long COVID, or do I have to get treated for Epstein-Barr virus? I mean, you know. And then the other thing I got diagnosed with is Hashimoto's. And I never had any of this stuff, you know? It's frustrating. We did a test for Lyme disease. You want to rule it out, go do it. Because the virus and or the vaccination did is, it either reactivates dormant viruses or pre-existing conditions and viruses you already had, and it reactivates them, and then you end up with all of these health issues. I also talking to my gynecologist, he was the one that he suspected I had MCAS, mast cell activation syndrome, because I was just so super sensitive to everything. Food, toilet paper, and just, you know, certain medications that I was taking. It was insane. So that's how we found out that I had some sort of histamine intolerance. And so I was put on a low histamine diet. Then we finally, in January of 2026, I had a doctor who said, even though we weren't sure yet, but she said, you most likely suffer from some sort of biotoxins in your body. And then we also did a visual contrast sensitivity test, because my eyesight changed drastically, which is also part of when you have biotoxins in your body. And biotoxins are a result of the virus and long COVID. So, and don't quote me on the terms that I use. I'm not a doctor. I'm just trying to explain my symptoms that I had and what we found.